Hi everyone, this is Erika Bennett with South Georgia Medical Center, and I'm here today outside of our Comprehensive Wound Care Center, which is currently undergoing some advancements and enhancements to services, and you will hear about more of that soon. I'm also joined by our President and CEO, Mr. Ronnie Dean.
Good morning.
Mr. Dean, how are you doing?
Good. Thank you.
I'm doing great. Today in the county, we are continuing to see COVID cases rise. We're almost approaching 2,500. How are the hospitals doing here?
Well, again, hospitals throughout the state are trying to figure out bed situations. Again, I'm networked with a lot of other hospital administrators, CEOs, and I don't think it's a surprise to everyone. I mean, the case numbers are going up. Positive COVID-19 diagnoses are going up. Hospitalizations are up. Non-COVID hospitalizations are up also, and I think because of that, the hospitals are really working hard throughout the region, throughout the state, Erika, to create that capacity so we can effectively and safely take care of everyone. Here at South Georgia Medical Center, we're very busy. 72 COVID positive inpatients in the hospital. That report was within the last hour. That will be our highest reported COVID-19 case volume on the graphics that everyone will see. We have had higher at times, and everyone please remember it's a snapshot in time and things are so fluid it changes. We'll have discharges, I'm sure, today, and that number will drop, and then we're anticipating more coming, and that's why we built the capacity that we built, and we continue to expand, and we'll talk about that maybe a little bit later. Unfortunately, 48 deaths, I believe, is the number that I've heard this morning throughout, the system. That's a cumulative number, and unfortunately, that number keeps growing, 1 or 2. Only 23, I believe it is, in the county, if I've got my number right. But 48 here at South Georgia Medical Center, and our heart goes out to all of those families. It's unfortunate that it's happening. Ventilators are very busy. 19 ventilator patients in the system, 7 are COVID-19. And then for personal protective equipment, we are using a lot, but we've stockpiled a lot for this reason. So we're really good on that, although we're having to refine our distribution processes so our team can access it efficiently. We don't want them to go without. Having it's one thing, getting it to the front lines is another, and we're working through that so they have everything they need in a timely manner. But I would say it's busy, teams working really hard, community is trying to do their part, but we got to do more. Otherwise, this thing's going to be with us for a long, long time.
Yes, and it has been with us for a while now, since March, so we have been, I think it's lasted a little bit longer than everybody would have hoped, and now the outlook is that it's going to be here for a while. So what can we do to help minimize the spread?
Well, the governor is encouraging us to do things. The Department of Public Health has been encouraging us to do things. CDC is encouraging us to do things, and I think we know what we need to do. I'll repeat it. Wear the mask. When we're not able to socially distance like we are right now, put the mask on. Socially distance, especially around people in quaint areas. The virus travels. And then, wash your hands. Don't touch your face. And then follow all the orders that have been given by the local, state, and federal officials about, protecting each other. I'm reminded every time I see a loved one that I could be a carrier and I can transmit. And I just tell the viewing public one more time, please don't talk yourself into thinking that you won't be harmed because you're of a certain age group. If you look through the state of Georgia, I think we've had deaths from age 17 to 90 plus. We've had admissions that 20-some-year-olds, 30-year-olds, and not so good outcomes, even here at South Georgia. So it's not just the older population, but I think the statistics prove out that it is the older population that's most vulnerable. Therefore, we that have a chance of protecting them from us and what we don't know, I think it's what we should do, and that's the way to slow it down. What we need to do is we need to go ahead and flatten the curve. We need to give ourselves a few weeks, be very, very vigilant about this, and I think we'll see this thing settle down. We'll head back into school. We'll have our business operations back to some normality. Vaccinations will come. Very positive developments in vaccinations. So I think buying time is really what I'm appealing to the general public to do. And y'all do that to help us help you, and we'll help each other through this. I really think that's the way to do it, Erika.
Okay. Mr. Dean, how are the staff faring through this?
Well, we have a team of 2,700 diversified, employees. They're healthcare professionals literally from all over the world, all over the nation that come here. And couple that with our over 400 physicians that are on staff that work throughout 4 hospital campuses. So I would tell you, every individual in the system is highly focused, highly committed, willing, and capable of getting us through this. And I'm very proud of them for that. They are tired, and we have brought in additional nurses and others, and we continue to add to our complement of clinical staff so they can have the resources they need to effectively and safely care for all of us. I believe I reported last time we were bringing in about 40 additional nurses. A sizable majority of those have come. I know 10 or more are scheduled to arrive Monday. We have opened another unit since we last talked that helps some of our overflow of other types of patients, and we have re-expanded our emergency room into an area for appropriate and safe holding of some patients. So we continue to find creative ways of expanding our capacity to include more enhancements to Smith-Northview, so we can use that when the time comes, if we need it, for all of the beds that are out there. Staff's doing a great job. Shout out to nurses, doctors, EMS, respiratory therapists, but let me shout out to another group. We don't call out these other guys as much, but they're just silently behind the scenes. And we talk about housekeepers, we talk about food service. Can you imagine running this hospital and being in the middle of this and not able to eat, not having the place clean? But what about our maintenance crowd? Sinks break, lights, need repair. They're air conditioned. They're constantly working on millions of square foot of facilities to make it work for us. So I just want to do a special shout out to our maintenance team. These maintenance engineers, they're as highly skilled as anybody on our team, and they come here and they don't miss a day, and they make sure our nurses and our other clinical professionals have what they need to take care of patients. And they're really some heroes among our staff, and we thank them for that.
Mr. Dean, there are a lot of things happening behind the scenes to improve access to care and improve access to specialty services within our system.
Right.
Is there any updates you want to share in that regard?
I do. Some of you may have heard we have opened a new primary care office in Nashville, Georgia. Dr. Jacqueline O'Kane, she is board certified family medicine. She will take care of adults and pediatrics in that area, team up with the other great physicians that we have in Nashville. And then, of course, you all know we operate the SGMC Berrien Hospital. She'll be a great addition to that staff. She's one example of how we aim to create even more access to care by placing physicians in local areas that need access to physicians. In addition, we have signed a number of specialists. We'll be announcing them as they start to arrive. We need lots of doctors in this region to meet the demand, and as we've said, we want everyone to be able to remain home and receive the care they can receive right here without having to travel. So our goal is to become the destination for specialty care in the region that can't be provided elsewhere, and we aim to do that in collaboration with other medical communities and bringing new physicians in. So very excited about that. Team's working really hard about growing our system to meet the needs of the community. So we'll have more to announce on that very, very soon.
Very good. It's definitely an exciting time to be at South Georgia Medical Center. A lot of positive things happening here, so proud to be a part of the team as well. Is there anything else you want to share? Or?
No, just again, wear the mask. I just can't ask you enough. It's hard, I know. Some don't believe it works. It does. Just let's wear the mask. Let's not touch your face, wash your hands. You know, stay away from each other if we can. I know that's silly, but it's the right thing to do, and we will get through this. And I'm really appreciative of everybody I see that do that. Georgians, South Georgians know how to whip this thing, and that's what we need to do, and I'm counting on everybody to help us. It means a lot when I see somebody wearing the mask.
Thank you, Mr. Dean. And thank you everyone for tuning in today. We look forward to sharing more exciting news with you soon.
Thank you.